In 2006, the Department of Health issued standards for better health, and this included patient focus by introducing the Jayex kiosk. This enabled United Lincolnshire Hospitals NHS Trust to get the information from the patients that allows us to improve our services.
The main problem we have is actually getting experiences that patients have in the clinic in a uniform manner against all clinicians. And it was problematic in the sense of using the old type of technologies of maybe using paper-based questionnaires to analyse this information. So we had to move with the times, such as technology like a Jayex kiosk, which was ideal for my purposes.
Jayex technology has been established since 1978, and we specialise in delivering flow process improvements and communication solutions for the NHS and public sector.
We selected the Jayex kiosk because it addressed most of the problems that we perceived that we were going to have with any kind of data gathering exercise. We looked at paper-based questionnaires, and that wasn't a viable option in terms of the cost and the man hours it would take to collate such data. We looked at web-based questionnaires, and that wasn't an option either. And also we looked at PDA systems, and all in, we felt the Jayex system was the best.
Jayex have been well known throughout the NHS by developing the Next Patient Call solution in 1995. And over the last 15 years, we specialised in two areas. One being the self-service touchscreen kiosks for patient outcomes, surveys, auto-arrivals and wayfinding. And the other being digital signage for information and education in the waiting room, as well as the Next Patient Call feature, of course.
Well, we've spent quite a bit of work in actually developing the core information that's going to populate the Jayex kiosk. The reason is we thought it was very important to actually ask our local population what was important to them in a consultation. So we went through a process of actually interviewing over 100 patients and asking them to tell us what were the top 5 things for you in the consultation. And from there we analysed that information and then constructed the questions which to populate the Jayex kiosk with. The response from patients so far has been quite positive in the fact that we're actually trying to measure this type of information, and they're quite supportive of the process that doctors will have a feedback loop into how they've been treating patients in the clinic. From a clinician's point of view, it's been supported because we're going through the process of revalidation at present, and at the current time we only seem to measure complaints. We don't really measure how many times the doctor gets it right.
There's a key target to really start reducing costs now and improving efficiencies and saving on time as well. Now, Jayex products really do that from both the auto-arrivals and the patient call. If we look purely at the Next Patient Call, this will probably save a clinician 30 minutes on a 4-hour clinic, allowing him to spend more time with the patients, patient targets being achieved in terms of less time in waiting rooms, and the patient experience being improved, and overall the NHS saving money.
Currently we're trialling the Jayex kiosks in ear, nose and throat services for United Lincolnshire Hospitals. Following this, an audit will happen after the first year, and we will hope to roll it out to head, neck and neurology services following this audit.
My vision for the future is very positive with the Jayex kiosk, because I see this adoption of this type of technology will be fairly widespread in the future in the NHS, because it's easily available information, and there are other changes in the horizon for healthcare in the NHS, such as the Sequin initiative, which will monitor basically patient satisfaction and quality with the type of service that you're providing. And I think we'll all have to deliver evidence on quality, and this, I think, is an easy way of doing it.